Hey guys, Dr. Allerton here. I wanted to make a quick video exploring anhedonia and taking a practical approach by asking yourself and your doctor 10 questions. Number one, do you currently meet criteria for a clinical depressive disorder like MDD, PDD? Um, do you have winter depression? The reason why this should be number one on your list is because if anhedonia comes with a collection of other classic depressive symptoms, then very often a wide variety of standard antidepressant treatments, such as antidepressants or cognitive behavioral therapy, is sometimes all you need to resolve the anhedonia with time. But there are a few caveats to this. Number one is that anhedonia is often the last symptom to improve and can persist for months after the rest of the depressive syndrome has resolved with treatment. The other nuance to this is that serotonergic antidepressants, while sometimes can resolve anhedonia, can sometimes make it worse. So you have to be very mindful of that if you try an antidepressant. Question number two, do you currently have chronic anxiety, PTSD, or unresolved psychological trauma that is currently affecting your life? This is number two on my questions because unresolved chronic anxiety, even if it's mild, is one of the most common causes of chronic anhedonia. And often treating the anxiety or the unresolved trauma is all you need to resolve the anhedonia. But like with number one, anhedonia is often the last symptom to resolve. Number three, are you chronically using or overusing mood boosting substances such as cannabis, nicotine, alcohol, benzodiazepines, or illicit drugs? This is a classic cause of anhedonia. When you chronically pound your dopamine receptors, especially D2 receptors, you will get a downregulation of these very important dopamine receptors in the reward circuitry of your brain, like the nucleus accumbens, and this can cause chronic emotional flattening and decreased hedonic tone, so that things that you would normally feel excited about, look forward to, now feel unexciting or uninteresting, and when you actually consume something like an experience that should be pleasurable, it all feels muted. When it comes to substance use causing anhedonia, really the only long-term treatment is prolonged abstinence, and it can take months for the anhedonia to go away even after abstinence is obtained. Next question is, how was your sleep? Chronic insomnia and certain sleep disorders that can go undiagnosed for years can easily cause people to feel zombie-like and can include anhedonia. And this can include both central and obstructive sleep apnea, where people have pauses in their breathing in the middle of the night. Classic symptoms that could clue you in to the fact that you might need to talk to your doctor about a sleep referral or a polysomnogram or a sleep study is if a partner or family member says that you snore heavily, you have pauses in your breathing during the night, or if you kind of wake up almost choking on your throat or gasping for air. Next question, is there evidence that you suffer from chronic low-grade inflammation? Inflammation in the blood and in the body almost always also means that your brain is inflamed. Symptoms of low-grade chronic inflammation can include daily or frequent malaise, vague joint pain or muscle pain, feeling apathetic, feeling nauseous and sick every day. There's an infinite amount of reasons why someone might have chronic inflammation. One of the easiest ways to screen for this is to ask your doctor about getting a simple, cheap, commonly available blood test called C-reactive protein, or CRP. A CRP of over 1 is elevated, and if it's over 2 or 3, that could easily be causing mental health symptoms such as anhedonia. All right, next question. Do you have a thyroid disorder? Hyperthyroidism and hypothyroidism can both cause mental health symptoms. Hypothyroidism especially is classically associated with depressive symptoms such as anhedonia. This is easy to screen for by asking your doctor to get a TSH, which is a cheap, commonly drawn lab. Next question, do you potentially have a nutrient or hormone deficiency that could help explain the anhedonia? Common ones that could cause flattened mood include low vitamin D, which is very common, especially in the northern states. It could be low iron. It could be low vitamin B9 or folate, or a B12 deficiency. And in men, low testosterone can easily cause anhedonia and apathy. A couple last questions. Are you on a medication that's known to flatten mood in some people? This can be serotonergic antidepressants, mood stabilizers / anticonvulsants like Depakote, lamotrigine, Topamax, Tegretol. Are you on an antipsychotic, or are you on lithium? All of these can flatten your emotional dynamic range and decrease positive emotions. And then for the last 2 questions, is your life devoid of hobbies, goals, and meaning? So a lot of people feel flat, and it could be that there was a period in your life, months or even years ago, where you had some big stressor that made you give up a lot of your hobbies or activities. And even though that stressor has passed, you might have just not gotten back into the things that gave your life meaning and joy. And if that's the case, getting back into those things can make all of the difference. And if you're struggling to get active again with the things that used to give you joy, you can ask your healthcare provider about a referral to CBT, which can include what's called behavioral activation and activity scheduling, which is a powerful treatment for anhedonia. Last question is, should you consider trying a medication for anhedonia? Right? So if all of those questions, you talk with your doctor, none of them really give you answers, then it might be reasonable to ask your doctor about medications for anhedonia. In my experience, the most effective treatments are going to be medications that boost dopamine and, to a lesser extent, norepinephrine. So the top 3 medications that I use on my patients for anhedonia is bupropion, which is also known as Wellbutrin, low-dose Abilify, which is a second-generation antipsychotic that, because of its special dopamine partial agonist properties, can actually boost dopamine at dosages between about 2 and 5 milligrams daily. And then, in my experience, the most effective medication I have found for anhedonia is pramipexole, which is a dopamine receptor agonist. It mostly boosts dopamine 3 receptors, but to a lesser extent, it also boosts dopamine 2 receptors, and both of these are very important in experiencing pleasure and reward, and can help light up your reward circuitry if it is hypoactive. All right, that should do it for today. Hope you guys are doing all right. Bye-bye.